Hello, my name is Ania McDonnell, and I am presenting on my Master's of Public Policy professional paper today for the Equity Leadership Conference. I am specializing and focusing on gender policy for my degree and minoring in urban and regional planning, and I will be graduating this spring. So I'm going to share my screen now to show you my presentation. So my paper is called Gender Mainstreaming in City Comprehensive Plans with a Transportation Focus. So to get right into it, this paper is a result of a culmination of research that I did throughout my time at Humphrey School. I researched the literature which gender was present, and I also did a lot of research on gender mainstreaming as a lens. So these really added into what I was able to do in this final paper and bring it into a city and localized context for policy. So I'm really excited to share this work. So first, I'd like to just define gender. Judith Butler, a known scholar in this area, has said that we can't really define gender because then we're putting people in a box, so to speak. For this, gender is a really difficult thing to define. Non-binary language is really important to start considering and including, because gender does not just mean woman, and gender, it's an elusive and difficult term to define. That's why I didn't define it here, but it's really important to discuss and think about, because when we're thinking about gender and transportation, gender can mean a lot of different things, and a lot of people are going to be impacted as a result. So gender mainstreaming here is defined by the UN as a way to make women's and men's experiences embedded in the design, implementation, monitoring, and evaluations of policies and programs. This allows for equal benefit for all people in political, economic, and societal contexts, allowing for future gender equality. So for my paper, I used a gender mainstreaming lens to analyze these policies, and it's a really great tool for doing this. A lot of countries actually use gender mainstreaming in their policies to make sure that it's providing equitable outcomes. So time poverty is a result of a buildup of multiple trips on top of one another. Trip chaining is not necessarily bad in itself. Trip chaining is just a connection of trips, as you see here in the figure. However, when we have time poverty, which is a result of often women are taking children to school the most and spending a lot of time doing that, or taking a lot of time to go to get to work and then go to get the groceries and then come home. This takes away from a woman's opportunity for economic income and employment, takes time away from the workforce and time out of her day. And so time poverty is a gender disparity in transportation. So women are having less time in their day to work and are taking more jobs closer to home, more part-time jobs, and this is reducing their income. Mobility of care is a term coined by a Spanish researcher, and this basically says that if we take different activities such as shopping, strolling, escorting, visits, and put them all together in a category called caring work, they would almost equal what the category of employment, as you see here. So if we are in our public transportation, understanding the importance of these different caregiving trips, shopping for home goods, escorting family members to school or to medical appointments, visiting sick or elderly family members, these are all really important, necessary trips to be making. So if we're adding those up together into a caring work category, here in the United States, we can see that this is going to be really important that we focus on caring work, and often caregivers are women. And so if we are supporting them better through public transportation, we won't just be focusing on the importance of employment. Safety is another big gender and transportation concern we see. So first of all, dark or deserted transportation stations are creating spaces that may feel unsafe or are unsafe for especially women or vulnerable populations, such as transgender people as well. And so it's really important to think about increasing the lighting and safety aspects of public transportation and transportation systems. Research by Dr. Yingling Fan showed that if we increase the safety of a transportation station through lighting or improving the space in general, this decreased perceived wait times by 10 minutes or more for especially mostly women were the ones that were the most impacted by this. So if we're reducing perceived wait times, people will feel safer and feel much more comfortable on their public transportation ride. Gender-based violence is a really huge problem related to safety and transportation. There's a lot of research in other countries about the need for separated transportation systems due to the amount of violence and harassment that happens on public transportation. But there is significant PTSD that can be a result of harassment or rape on public transportation. And a lot of women may not have the option or opportunity to take a different form of transportation. They may not be able to afford a vehicle, so they will potentially have to continue to endure or fear that they will have to endure this type of harassment again. So I decided for my research to look at city comprehensive plans. These in Minnesota are plans written by cities to create a long-range plan for the next 10 years for that city. They're broad and regional, and they're a really good way to think forward and look forward for a city. So I randomly chose 4 cities for this research: Minneapolis, Bloomington, Little Canada, and the city of Centerville, to analyze. And Minneapolis has a really groundbreaking study. They actually included an equity chapter in their city comprehensive plan, which is pretty innovative for a city in the United States. So this was really exciting. And so I wanted to take a look at this one, especially in particular, but also the other cities, as they have a geographical balance and a difference in their city sizes and their city operations. So first I did a word search for these words: safety, mobility, accessibility, gender, access, harassment, binary, lighting, to see what is included in these plans. And so as you will see, gender was not present at all as a word in any of these plans. Gender was not accounted for at all. Safety, there was some mention of it, a lot in the city of Bloomington. Mobility, there was some mention of it. Access, again, but that is a lot to do with highway access. Child was mentioned once, and lighting a little bit. And so these were really kind of shocking and interesting results. Next, I looked at gender mainstreaming. So I took the policies and compared them to gender disparities in public transportation to see how these city comprehensive plans are influencing or helping or improving these known transportation disparities, such as time poverty, accessibility, safety concerns, whether or not these plans are acknowledging these safety concerns. So the first one, time poverty. So this is a policy from one of the plans: making strategic investments around individual stations that create safe, high-quality, walkable districts for living, working, shopping, and recreating for people of all ages and incomes. So I thought this was a pretty good policy. It works to reduce trip chaining time, creating more walkable communities with access to amenities, non-deserted areas so people are safer. But it could have included all ages, incomes, and genders to better think about the ways that we're including all genders and all experiences into this. But it is looking for walkable districts for living, working, and shopping, which is really good for people who have to take care of large families or who have to get to work and take care of their children. So here under safety, I looked at a few as well. Building and maintaining a network of bikeways, including greenways and accessible protected bike lanes. these protected bike lanes increase safety for women. Professor Sherry Davis at San Diego has found that women are less likely to bike if there's not these safer bike lane options, but men are very willing to bike still to work. And for the next one, the policy says encourage and design for streetscape amenities, street furniture, street lighting, trees, landscaping. And I think this is a really good and important policy to improve upon it, including more and more street lighting where possible, and creating just safer public transportation um, waiting areas. However, I wanted to add my own language for the city comprehensive plans that I suggest. So for the first one, encouraging the development of direct transit routes to activity centers such as shopping, which includes grocery, medicine, home maintenance goods, healthcare, schools, religious centers, and recreational centers to best connect individuals with low access to dense areas of need. And then I wrote one about safety. Maintaining a safe transportation system through improving neighborhood lighting, public transit stop lighting, and monitor road and sidewalk weather cleanup for pedestrians, especially those with strollers, walkers, wheelchairs, and other mobility concerns. So these are just two. I would love to dig into this more and write more, but it's some ideas here for city officials and the transportation consultants that may be writing these comprehensive plans. Finally, I wanted to provide some recommendations for cities and transportation consultants. So number one, connecting school, daycare, and workplace land uses through zoning and tax incentives. I think that if we're connecting schools and workplaces near one another, that will make these trips much shorter and it much easier for caregivers and families to both work and take care of their family, and for their transit routes to be much simpler and more effective. And if we're providing tax incentives for this co-location, I think that could be really powerful. Also, tax incentives to create routes between high unemployment neighborhoods to areas of employment. Amazon warehouse in Shakopee, Minnesota has done this, where they provide bus routes for people between the two, and I think this is a really great opportunity for increasing transportation options for people. Providing transportation vouchers to women and family receiving TANF, which is like a welfare program. So if we are requiring people in these programs to use transit to complete the program, then we should provide vouchers. This can be carpooling, van pooling, Ubers, Lyfts, free public transit, that type of thing. I think there should be a full gender and equity review of a full comprehensive plan for a city. I just looked at the transportation section, but this could include housing, land use, all of the others, to make sure that there's a gendered component included. I think that cities should partner with transit agencies to create night stops for their public transit routes. A night stop is basically a stop in between two bus stops to make a safer walk home for people if it's late at night. You know, we have nurses, we have servers, we have people who are working in retail who are not working the 9-to-5 shift, who may have transit needs at night. And finally, cities should collect city-level transportation data that is disaggregated by gender. And I did want to provide some recommendations for further research. I think that more research into off-peak transportation schedules is really important for those part-time workers who have to take transit at night. Increasing access to vehicle ownership for targeted populations. This has shown to actually increase employment opportunities, employment more than education for people and communities who have less transportation access. So this is really important. And researching emerging technologies such as connected autonomous vehicles and their impacts on vulnerable and diverse communities. I think we have just brushed the surface on this, and that these technologies are going to really need to build in that component of equity and gender as an important part of that creation. So thank you so much for listening to my presentation.